Good morning, everyone. Today's topic about fungal infections of skin and soft tissue infections. So, in this topic, we are going to discuss about. So, today's topic about fungal infections of skin and soft tissue. So, at the end of this session, you will be understanding about the list of organisms causing superficial, subcutaneous, as well as the opportunistic mycosis. So, what are the microorganisms which causing the superficial, subcutaneous, opportunistic, and you will be able to understand about the pathogenesis, clinical manifestation, laboratory diagnosis, and the treatment of each one of the infections. Before going to the topic, I would like to tell you what are the fungus, how these fungus are classified based on the morphological feature, what are the various types of fungal infections. So the fungal infections may be classified into the superficial, subcutaneous, opportunistic, and the systemic fungal infections. The fungus will be classified based on the morphological feature. So the fungus are yeast-like fungus, yeast fungus, true yeast fungus, mold group of fungi, and the dimorphic fungi. What do you mean by true yeast fungi? The example is Cryptococcus neoformans, which causes the cryptococcal meningitis. So all the yeast group of fungus which are unicellular in structure, all the mold group of fungi which are multicellular in a structure. So the example of yeast-like fungi example is Candida albicans and Candida non-albicans. The mold group of fungi example Aspergillus, Rhizopus, Mucor, and the final one is a dimorphic fungi, which will be classified based on the structure, which will produce two type of colonies. If you incubate the dimorphic fungi in a 37 degrees Celsius, which will produce a yeast type of colonies. If you incubate at a 25 degrees Celsius, which will produce the mold group of colonies. The example of dimorphic fungi is Penicillium morbified and Histoplasma capsule. Okay. So today's topic about the superficial mycosis. So the most predominant superficial mycosis is the dermatophytosis caused by the dermatophytic fungi, the Trichophyton, Epidermophyton, and the Mycosporum. So among the superficial fungal infection, the most predominant fungi is the Trichophyton fungi. Okay, so we'll discuss each one in a detail about the superficial, subcutaneous, and the opportunistic mycosis. The opportunistic mycosis causing the skin and soft tissue, which will be very rarely, which may causes the opportunistic skin infections like the Candida, followed by the mucormycosis, and very rare infections caused by the opportunistic of skin and soft tissue, that is Penicillium also. Okay, so coming to the superficial mycosis, the fungi which exclusively infect the superficial keratinized tissues. Our skin layer, which is made up of the protein is nothing but a keratin, the fungus which will infect the keratinized tissues, which can cause the infections only in the superficial layer. So, most of the superficial fungal infections which are able to digest the keratinized tissues, which may cause the infections, the fungi which exclusively here infect in the dead layers, there is no contact with the living tissues. So, most of the infections which can change is only the cosmetic effect. The majority of the skin and soft tissue infections caused by the fungi due to the dermatophytes, and the Taenia versicolor caused by the Malassezia furfur fungi, which is a lipophilic yeast group of fungi, and Taenia nigra and the Pierra is another example of superficial fungal infection. We discuss one by one in a detail. The first one is Taenia versicolor, otherwise which will be called as a Malassezia furfur is the name of the fungi. So Malassezia furfur now which will be called as a Tyrosporum orbiculare, which is exclusively a lipophilic yeast group of fungi, which mainly infect the chronic disease which involve the stratum corneum part of the skin. So, which is characterized by the discrete macular areas of discoloration of the skin. Most probably, these infections which will commonly affect in the young adult, especially in the summer period. So, because of the excessive sweating, the person may be affected with the lipophilic yeast, The name of the fungi is Malassezia furfur, otherwise it's called as a Thyrosporum arbiculare, which causes Taenia versicolor, otherwise it will be called as a Thyriasis versicolor. So you can see this picture, the patients which will be infected with the blotchy discoloration of the skin, which may form a severe itches, the lesions which can be a hypo or hyperpigmentation of the skin. So whenever if you want to identify this fungi, we can collect the skin smear from the patients at the edges of the lesions by using the sterile blade. You can scrape out the skin and you have to send for the microscopic feature. In microscopically, we can identify this fungi which will produce the lipophilic yeast form. So the predominant identification feature you can see among these patients in the graph staining, you can see the spigopti meat ball appearance is the predominant identification feature for the identification of Taenia versicolor. So the spigopti meat ball appearance, which is the most specific identification feature for Taenia versicolor disease, and also you can identify this fungi by isolating in a Sampos dextrocellular, which produces the fried egg colonies after incubating 5 to 7 days at a 37 degrees Celsius. And another example about the Woods lab examinations, which will give the golden yellow fluorescence, which will be identification for air infection, air infector, the fungi. Okay. So coming to the treatment, majority of the fungal infections which are treated by the fluconazole, itraconazole, the most effective antifungal drug is terbinafine. So terbinafine, which will be the effective form for the treatment aspect about the Taenia versicolor. So the next one, Taenia nigra. Taenia nigra, which is also an important superficial fungal infection, which is a localized infection of stratum corneum, commonly which can be seen in the palmar aspect of the hand, caused by the Cladosporium vernicae is the fungi, otherwise now which will be called as a Orchia vernicae is the name of the fungi, which is a very dermatitious fungi. What do you mean by dermatitious? The fungi which will produce the black color lesions. Even if you isolate this fungi in a STA, which will produce the black color of fungi, those fungi will be called as a dermatitious fungi. So they produce a black or brownish macular lesions, most probably which can seen in the palmar and the plantar aspect of hand and the feet, most commonly seen among the female species. So you can see in this picture, there will be a black non-scaling macules which will be seen in the palmar aspect of the hand. There is no inflammatory reactions. You can see in this picture that STA which will produce the black colored colonies for Taenia nigra caused by the Viagra RTA. So now we'll move on to the next important topic about dermatophytes. Dermatophytosis caused by the dermatophytic fungi, Trichophyta, Epidermophyta, and the Microspora. Dermatophytes, which are a group of closely related filamentous fungi, which will infect only the superficial keratinized tissues and especially the skin, hair, and the nail. So, in the collectively the clinical condition which will be called as a dermatophytosis or ringworm or a taenia. So, the most predominant dermatophytes, Trichophyton, followed by Microsporum and the Epidermophyta. So, coming to the causative agent of the dermatophyte, if you see the skin infections caused by Trichophyton, Epidermophyton, and the Microsporum. If you take a air infection which will infect only by Trichophyton and the Microsporum, the air infection does not cause by Epidermophyton. If you see the nail infection, the Trichophyton and Epidermophyton are the causative agent. Microsporum does not cause a nail infection. So the dermatophytes, as I told you, the dermatophytes are the keratinophilic fungi which will infect the keratinized tissues, mainly our superficial skin made up of the protein, which is nothing but a keratin. So all the superficial area, skin, nail, and hair made up of the keratin, the dermatophytes which will infect the superficial areas. These the infections which can occur from the zoonotic infection, the infections which will be very more severe. So what are the source of infections? You can see there will be an anthrophilic, zoophilic, and the zoophilic. What do you mean by anthrophilic? from the human to human transmission. From the infected human to the infections which will be transmitted to the non-infected persons, those infections which will be called as anthrophilic. The anthrophilic dermatophytic fungi, the most important Trichophyton rubrum, Mentalophytes and the Thomsonans, Microsporum adoni and Epidermophyton flocosum. Coming to the zoophilic dermatophytic group, if the infections which will be transmitted from the infected animal to the human, those infections will be called as the zoophilic infections. Most important zoophilic fungi is Microsporum canis from the infected cat to the humans which will be transmitted. The next one is zoophilic. Zoophilic from the environment. Most of the fungus which will be present in our environment, for example, the Trichophyton azote and Microsporum gypsum, which is the predominant one normally present in our environment, which will be transmitted from the soil saprophyte to the humans, which will be called as a geophilic group of fungi. So these